There are a number of ways in which art is powerful in its effects. It can improve a space, it can make people's moods better. Being involved in the hospital rooms is being part of that journey of just bringing to the public consciousness this idea that art can be used as a way of talking about mental health.
Hospital Rooms is an arts and mental health charity that commissions extraordinary art for inpatient mental health units. We collaborate with brilliant artists, mental health service users and NHS staff, and we transform spaces with very stimulating, interesting, vibrant artworks that bring a bit of humanity to often cold and clinical spaces. We're here today in Shapeshift, which is a Hospital Rooms exhibition at Fitzrovia Chapel. It seemed like the perfect place to have an exhibition about this project in Health and Hospital. Shapeshift is an exhibition that explores the way that we can re-look at what mental health hospitals can look and feel like. The project and the exhibition has 15 incredible artists involved in it. Mental health hospitals are often very similar to each other. They can feel quite claustrophobic. They can feel stifling. We found from doing this over 9 years that bringing in some colour and creativity and the opportunity to make yourself is something that can change your experience of being in hospital.
I work in mental health hospitals on a day-to-day basis, and the environment is so important. Having places to be that you feel that you can be yourself in. It isn't a blank white wall that you're staring at. Actually, it's beautiful artwork that you can be inspired by, and that's a real gift. I got to be a part of lots of the workshops. There was one gentleman from one of our wards, and he drew a hot air balloon, and he said, "I haven't drawn since school, and actually it's really important to me because it signals the kind of end of my journey here." And if you go to our gym now, an entire wall is covered in hot air balloons. And for me, like forevermore, I will look at that painting and I will look at hot air balloons and think, it's a new beginning.
I became involved with hospital rooms quite a long time ago now. I was really interested in this idea that they had of how visual arts could be used to improve the experience and built environment in hospitals and affect positive change. My particular take on it was always that I didn't want to just do something which was there as decoration. I wanted them to ask you to kind of reflect on the situation that they're in.
The piece Like There Is Hope and I Could Dream of Another World was based on something that was said by a mental health patient. And there's something so interesting about this being painted so large on the entrance to a hospital, the first thing you might see. And it's both hopeful but also complex. We've completed 26 projects. That's about 44 different wards. We think we could do much more, but we've reached maybe a fifth of the different mental health trusts in the country. So over the next years, we hope that we can reach all of them. The exhibitions that we do are so important because the work we do in hospitals is only seen by a very small amount of people. It's really important that we share the work more widely so we could talk about the difficulties and the challenges in these spaces and what we need to do together to make spaces better for people in mental health units.
It's been an absolute privilege to work with them. They're incredible people, and to bring that to people in their darkest days, to offer them a little glimmer of hope. What an incredible charity.